Katy Talento.
Thank you, Congressman. So if the MAHA movement's taught us anything, it's that healthcare is a winning issue. And the American families, they care. We care. Moms like me, we care. Grandmothers like me, we care about the crushing impact of illness, chronic illness, that basically got President Trump reelected. And thanks to the wonderful collaboration with Secretary Kennedy. And so I want to talk a little bit about that today. You know, I used to work in the White House in the first term, and I have the scars on my back from Republican failures to repeal and replace Obamacare. And for too long, Republicans, you know, everyone said, y'all just want to take healthcare away from us. That if we said the word healthcare, we lost an election. Because that's how the voters viewed us. You just want us to save more for healthcare. You're just going to give us Obamacare, but a little less. And they were right. That is what we were advocating for. But that has all changed. People are sick and tired of these giant industry interests. And, you know, people ask me a lot because I've been lobbied by all of them for 20 years. Who are the biggest Bond villains in healthcare, in the healthcare swamp? I'll tell you who it is. It's PBMs, it's the fake charity hospitals that are raping and pillaging their communities, it's the carriers, and it's pharma. So I'm just gonna tell you right now, it is great to hear these members of Congress behind me saying, screw the lobbyists, we're done with that. If we don't go big, we're all gonna go home. And so it's about time that we take the opportunity of a reconciliation. This is a gift from heaven that, you know, founding senators once gave us, founding members of Congress gave us in the budget process. And if we don't use it, we are the dumbest and we don't deserve power. Yes. So this is something we have to do, y'all. And, you know, when I got out of government, people with my resume, they go and they just shill for some disgusting industry interest. And I looked around, I just couldn't do it. And so what I do today is I build health plans for mid-market employers, a few thousand, a few hundred employees. And the only way we can save them money and increase their benefits is to fire the PBM, fire the carrier, and avoid hospitals like the plague. We give them concierge direct primary care. We give them beautiful hand-holding white glove navigation to the highest quality and the lowest cost sites of care. How can we do that without transparency in pricing? We can't. And too many of these hospitals, they are lying. Too many of these carriers are putting out garbage data. I was so relieved to see the secretary last week talk about tougher enforcement, finally, against these loser hospitals that are trying to screw over patients and chase and pursue and send their patients to debtor's prison. It is about time that we stop messing around. I will use no four-letter words here. Stop messing around with these interests anymore. And I'll tell you, this industry, it is a fifth of our economy. It is eating our economy. It is stealing the American dream from the middle class. And I stand so proudly with all these people here. You know, I'm old enough to remember when Republicans thought that, tax cuts were not government spending. Remember when we weren't afraid to worry about pay-fors when it came to tax cuts? Democrats used to give us all kinds of grief for that. Now we're so worried about paying for tax cuts. Healthcare should be tax-free. The president, he intuited all this policy. He intuited it back in November when he put out on True Social, we need to take every dollar away from big insurance companies and give it to the people. That's what all of us are standing here today to promote. I'm proud to stand with them. And I call on Congress, use the power that you have, or why are you even here? Thank you.